Hello, welcome to another episode of Arthritis and You, a Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Have you ever stood in the supplement aisle, staring at a bottle of collagen and just wondered, is this really going to help my joint pain or is it just, another trend? It's definitely a crowded space out there. And confusing, especially if you're managing something like osteoarthritis. Well, today we're aiming to cut through some of that noise, give you a clearer picture. Our deep dive is all about collagen. It's this powerhouse protein getting a lot of attention for potentially helping with rheumatic conditions. We've gone through quite a few sources, focusing heavily on the natural health products section of the Alberta Rheumatology website. It's a really solid, evidence-based guide. So our mission today, unpack that science for you, give you insights to make genuinely informed decisions.
And that's exactly the goal, to equip you with clear, actionable insights, not just, more noise. We'll break down what collagen is, explore the theories behind how it's supposed to work in your body, and most importantly, we'll dive deep into the studies, see how effective it really seems to be for osteoarthritis. Plus, we'll cover the practical stuff like safety, side effects, maybe even mention specific products with some evidence, so by the end, you should feel pretty well equipped.
Okay, let's unpack this then. Before we jump into the studies and, the results, we really need to get what collagen actually is. Think of your body like a building. Bones are maybe the concrete, muscles the walls. Collagen's like the steel rebar holding it all together. And the glue, it's the most abundant protein we have. Gives strength, structure, elasticity to almost everything. Skin, bones, you name it. The sources we looked at highlight three main types relevant here. First, type 1 collagen. This one's the workhorse. Strength and structure. Makes it about 90% of your body's collagen. It's in bones, skin, tendons, ligaments, foundational stuff. Then there's type 2 collagen. Super important for joints because it's the main protein in cartilage, that smooth, cushiony tissue.
Right, the stuff that lets joints glide.
Exactly. And then type 3 collagen, often found with type 1, helps structure skin, muscles, blood vessels. So clearly it does a lot more than just joints. It's vital for bone growth, density, wound healing.
Yeah.
And skin elasticity and hydration. That's why you see it in so many beauty products.
Mm-hmm.
Absolutely. And what's fascinating is taking those broad roles and applying them specifically to rheumatic conditions, particularly for something like osteoarthritis, where that cartilage cushion wears down. The idea is maybe supplementing with collagen could help, could potentially reduce pain, stiffness, maybe even improve function overall. The thinking on how it works is sort of multi-pronged. Maybe it helps rebuild cartilage tissue, maybe reduces fracture risk by supporting bone density. And there's even some thought that certain types might have anti-inflammatory effects, calm things down in the joint, basically providing building blocks or perhaps signaling the body to, start repairing itself.
Okay, so that's the theory. But here's where it gets really interesting. Does it actually work?
Yeah.
This is the core of the deep dive, right? Looking at the studies from our sources, what did they actually find for osteoarthritis? Let's dig in.
Absolutely. Let's break down the science. First up, a study looking at type 1 and type 3 collagen. This one used a specific collagen peptide product from nitogelatin, derived from pork skin and bovine bone. Patients with knee OA took 5 grams twice a day, so 10 grams total daily. It was a good quality study, double-blind, placebo-controlled, randomized 30 patients. And after 13 weeks, both the pork skin and bovine bone collagen showed, pretty encouraging improvements. Let's talk numbers. Pain on that 100-point visual scale, reduced by about 32 points for pork skin, 38 for bovine bone. That's quite a drop.
Yeah, 15 or 20-point drop is often considered noticeable, so those are pretty significant shifts.
Exactly. And function, using that WOMAC score.
Yeah.
Improved by 16 points for pork, 25 for bovine, also good improvements. And what's really notable, 63% of those taking the pork collagen had what we call clinically important changes.
Meaning big enough to actually feel a difference in daily life, not just a statistical blip.
Precisely.
Yep.
And importantly, no serious side effects were linked to the product in this trial. Small study, but well done and positive results.
Okay, that paints a really encouraging picture for those type 1 and 3 collagens. Real, tangible improvements. But collagen's a big category. What about other types, like the ones from chicken cartilage? Were those tested too?
Great question. Yes, there was another key study on something called BioCell collagen. This is different. It's a hydrolyzed chicken sternal cartilage extract. So type 2 collagen, but broken down, hydrolyzed for easier absorption. It also has things like hyaluronic acid in it. This study involved 80 patients, moderate to severe hip or knee OA. They took 2 grams of BioCell, twice daily. Double-blind, placebo-controlled again, findings. BioCell Collagen improved the provider global assessment, that's the doctor's overall assessment, and it also reduced pain compared to placebo. They saw a clinically important change in the overall WOMAC score by day 70, so fairly quick.
Day 70, okay.
Yeah. But interestingly, there wasn't a significant difference between the groups for the WOMAC subscores, pain, stiffness, function, looked at separately.
So the overall picture improved, but maybe not every single aspect individually.
Kind of looks that way in this study. It was generally well tolerated, though. One person had a mild skin rash, stopped the product, it went away.
Okay, so positive signals for type 1 and 3, and also for this specific hydrolyzed type 2 from chicken.
Yeah.
But what about undenatured type 2 collagen?
Yeah.
UC2, that one gets talked about a lot. Is it different? How does it stack up?
That's a crucial one, yeah. UC2 is popular, and it works on a different proposed mechanism. Unlike hydrolyzed collagen, which is broken down, UC2 is undenatured. It keeps its original complex structure, the theory. That specific structure interacts with the immune system differently, maybe helps retrain it to not attack the body's own cartilage.
So not just building blocks, but more like an immune modulation thing.
Potentially, yes. A very different idea. And the research on it has some interesting nuances. There was one big multi-center study, randomized, double-blind, 191 patients, moderate to severe knee OA, and they compared 40 milligrams of UC2 daily against placebo and against glucosamine and chondroitin combined. So a really informative design.
Right, comparing it to other common options. What did they find?
Well, at 6 months, UC2 was statistically more effective than both glucosamine and chondroitin and placebo at reducing knee pain. Pain reduction was 23 millimeters on that visual scale for UC2 versus 18 and 17 for the others.
Okay, statistically better.
But, and this is a really key point from the sources, super important for you listening, neither product produced a clinically important change in pain overall for the average patient.
There's that distinction again. The numbers moved, but maybe not enough to feel dramatically different day to day for many.
Exactly. It might be significant on paper, but maybe not life-changing in reality for everyone in that trial. That's the nuance. Interestingly, UC2 did statistically lower the total WOMAC scores, but both UC2 and the placebo group actually showed a similar clinically important reduction.
So the placebo effect might have been strong there too.
Could be, it happens. What was different was that people on UC2 used less rescue medication, like acetaminophen. So that might hint at some level of underlying relief. Generally well tolerated, though. Heartburn was mentioned as possibly related, but not definitively.
That difference between statistically significant and clinically important is just so vital. Thanks for highlighting that. So that first UC2 study, interesting but complicated findings. Was there another one? Maybe one that showed something different?
Yes, there was another trial that helps paint a fuller picture. Also randomized, double-blind, compared 40 milligrams of undenatured type 2 collagen, this time taken twice daily, against glucosamine, chondroitin, and placebo. 101 patients with knee OA.
Okay, slightly different dose timing and the results.
This study actually showed some stronger results for UC2. It showed greater reductions in the total WOMAC score compared to both glucosamine, chondroitin, and placebo. And importantly, both the type 2 collagen group and the glucosamine chondroitin group reduced the WOMAC pain subscale by 40%. And that was considered a clinically important reduction from baseline.
Okay. So this study did show a clinically important reduction in pain for UC2, similar to glucosamine chondroitin.
Exactly. So in this trial, we see UC2 performing more strongly, showing significant pain reduction and overall joint health improvement comparable to established supplements. It just highlights how, research evolves.
Yeah.
Different trials, even with similar things, can sometimes yield slightly different results. That's why looking at the whole body of evidence is key.
Okay, so taking all these studies together, type 1 and 3 showing promise, BioCell showing promise, UC2 showing promise, but maybe with some nuances. What's the overall bottom line from the sources for someone wondering if collagen is worth trying for their OA?
Well, the consensus from the sources we reviewed is pretty clear. Collagen may be effective, specifically for decreasing osteoarthritis-related knee pain and improving physical function, particularly in the short term. We're talking, the 2 to 6 month range based on these studies.
So not a definite yes, but a promising maybe?
That's a good way to put it, a promising maybe.
And it's really important you stress this. More research is still needed, right? Especially for long-term benefits and safety.
Absolutely critical. These are mostly short-term studies, 6 months or less. We don't have decades of data like some other treatments.
So it's not a silver bullet yet, but maybe a promising lead, like exploring a new path. seeing good signs, but I haven't mapped it all out.
Precisely. Which leads us straight into safety. Always crucial. Based on these sources, collagen peptides seem generally well tolerated for up to 6 months. Good news for short-term trials. However, because the studies mostly stop there, the safety of using it consistently long-term, that remains largely unknown.
That's a really significant point. Lack of long-term data.
It is, and it underscores why more research is needed before we can say it's fine for years and years.
Okay. And what about side effects for short-term use? What should people watch out for?
They're usually mild, mostly digestive stuff, things like stomach upset, maybe some nausea, heartburn, sometimes constipation, and occasionally a mild rash can occur. The advice is pretty standard. If you get itching or a rash, stop taking it.
Makes sense. Any known interactions? If someone's taking other meds or supplements?
According to these sources, currently there are no known interactions, which is generally reassuring for people managing OA with other things.
Okay, that's helpful. And practically speaking, it's one thing to know the type of collagen, but are there specific products mentioned in the sources that align with this evidence?
Yes, the sources do give some examples which can be useful guides. For bovine skim collagen, that denatured type 1 and 3 examples listed include Organica Enhanced Collagen Original, NOW Collagen Peptides Powder, and Vital Proteins Collagen Peptides. Dosage there is typically around 10 grams once daily.
Got it. NOW, Organica, Vital Proteins for type 1 and 3. What about the others?
For BioCell Collagen, that denatured type 2 from chicken cartilage, examples are Organica BioCell Collagen, Health Logics BioCell, Herba BioCell Collagen, and NOW BioCell Collagen, usually dosed at 1 gram twice a day.
Okay, 1 gram twice daily for BioCell. And the UC2.
For UC2 collagen, the undenatured type 2 examples include Piping Rock UC2 collagen and NOW UC2 collagen. The dose there is much smaller, typically 40 milligrams once daily.
Wow, yeah, much smaller dose for UC2.
Yeah.
So obviously check the label, talk to your doctor.
Yeah.
But are these specific brands the key, or is it more about getting the right type and form of collagen?
That's a really practical question. While the sources list brands used in studies, the most important thing is likely ensuring the product contains the specific type and form that has the evidence. So if a study showed benefit for, say, undenatured type 2 collagen at 40 milligram, you'd look for a product confirming it has that, ideally at that dose. The brand might be less critical than the verified ingredient.
That makes sense. Focus on the ingredient spec matching the research.
Exactly. And, this whole discussion really flags that important question we touched on, the difference between statistical significance and clinical importance. It's worth hitting again. A statistically significant result means, the change probably wasn't just chance, but it doesn't automatically mean it's big enough to make a real noticeable difference in your daily pain or function, your quality of life. Understanding that nuance is just so key when you're looking at any health claim or study. Look beyond the numbers to what it might actually mean for you.
Couldn't agree more. So as you, our listener, explore options like collagen for OA, remember this deep dive. Collagen may offer some short-term help. The science is developing, but long-term. Still questions there. It's not a yes or no. It's that promising maybe. And it absolutely needs a conversation with your physician. Think of it as maybe one potential piece of your larger joint health puzzle, not the whole solution. The biggest takeaway, always consult your doctor. They know your health history, what else you're taking. They can help you weigh this evidence properly. But hopefully, armed with this info, you can be a more active participant in that conversation. Apply that critical thinking. Understand what you're considering and why. Thanks so much for joining us for this deep dive today. We really hope this information helps you feel more informed and more empowered on your health journey.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Ubis, technical producer, John Ifund, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another deep dive.